So firstly, I would like to begin by acknowledging the traditional custodians of all the lands that we're meeting on today and pay my respect to the elders past and present and future. I also acknowledge my gratitude that we share this land today, my sorrow for some of the costs of that sharing, and my hope and belief that we can move to a place of equity, justice, and partnership together. So thank you everyone for joining us and welcome to the Choosing Wisely October webinar. It's my pleasure to welcome Caroline Zoers, who is the Policy Manager at the Australasian College of Dermatologists, one of the medical colleges who are helping us to lead Choosing Wisely in Australia. So I'll hand over to Caroline to speak to you about the work that they are doing with consumers. Thanks, Caroline.
Thanks, Anne-Marie. Okay, so yes, thanks, Anne-Marie. Before I start, I'd like to acknowledge the traditional custodians of the lands from which I join you today. So it's the Darug people, and pay my respects to elders past, present and emerging. So thank you all for joining us today, and thank you to the Choosing Wisely team for inviting me to present. So just a bit of background. So ACD, the Australasian College of Dermatologists, has been a member of Choosing Wisely since 2015, and we launched our first 5 recommendations in 2016 and a further 3 earlier this year. But today I'm very excited to have the opportunity to give you a little snapshot of how we at the ACD have been integrating the Choosing Wisely principle of consumer-focused communication and the 5 questions to ask into our community-facing work over the last 18 months or so, particularly through our annual Worldskin Health Day campaigns. So a bit of background about the college. ACD is the sole medical college accredited by the AMC for the training and continuing professional development of doctors in the specialty of dermatology. And as the peak membership organisation, we represent just under 600 dermatology fellows and 100 trainees. And as the leading authority in Australia for dermatology, we also provide information, advocacy and advice to patients, community, government and other stakeholders on skin health and dermatological practice. And our vision is for the highest standard of skin health and dermatology care to be available and accessible to all patients and communities. As a small college, it's particularly important that we take a collaborative approach, be it with the AMA, other medical colleges or organisations like NPS Medicine Wise, and also with patient support groups to ensure that the needs of people with skin, hair and nail conditions are heard and met. So as part of our community and international engagement, ACD has been participating in World Skin Health Day since 2018. The day is a joint initiative of the International League of Dermatological Societies and the International Society of Dermatology, and it aims to recognise and promote skin health around the world. Our annual campaigns have showcased the diversity of skin diseases in Australia and highlighted the challenges and psychosocial impacts of living with these conditions. In 2019, for example, we commissioned a detailed patient experience report highlighting a number of challenges faced by patients and their families, which included the hurdles they face in accessing care. And unfortunately, there are some very real access barriers. So with just 590 specialist dermatologists in Australia, we have a substantial shortage. And it goes without saying that it can be hard, particularly for people in regional, rural and remote communities to access the care they need. It also limits the exposure of medical students and other health professionals to dermatology. And a lack of public dermatology consultant positions means the majority of dermatologists work predominantly in the private sector. So as a college, we're working with federal, state and territory governments to increase the number of consultant and training positions in public hospitals. We're also very focused on optimising the use of technology-enabled and multidisciplinary models of care, supervision and training that will be really vital to addressing these access issues, particularly in the short term. So these very tangible access issues aside, we want to make sure that when people are able to access care, that they can get the most out of their consultation with their dermatologist. And this means preparing patients, our fellows and our trainees to engage in good communication that is consumer-centred. And this brings us to Choosing Wisely and Worldskin Health Day 2020. So for our 2020 campaign, the challenges of COVID-19 gave us an opportunity to extend the theme of access by focusing on the role of telehealth. And before the pandemic, telehealth was already well recognised as a valuable model of care in dermatology. It even has its own name of teledermatology. The ACD has been a long-standing advocate for its use, where appropriate, as a safe and accessible model of delivery of specialist dermatology care, particularly for Australians in regional, rural and remote areas. Although for many, a consultation with a dermatologist prior to the pandemic would have been from their GP's clinic rather than their own home. Teledermatology was already integrated into our training programme, and we were able to publish peer-reviewed teledermatology guidelines to support our fellows in public and private practice, pretty much as soon as COVID arrived. All this meant we're in a good position to support our fellows and patients, and we very rapidly developed a range of resources, including a patient fact sheet on telehealth. Enhancing that fact sheet and turning it into a more accessible, useful tool for consumers became the centrepiece for our 2020 Worldskin Health Day campaign. In our campaign planning, we aimed to target 3 key audiences: patients and community to raise awareness of dermatologists and the conditions they treat, support them in accessing care in a new way in the new normal, and to support shared decision-making. For government and policymakers, to seek continued funding for phone and video consultations for all dermatology patients, regardless of location. And for dermatologists, through our advocacy, to enable them to retain the flexibility to use the most suitable mode of care given an individual's circumstances, to provide a practical tool to support their practices and patients, and also to raise dermatologists' awareness of patient perspectives of receiving care by telehealth. So having prepared and informed consumers optimises consultations and care. And integrating the theme of It's OK to Ask provided us with the opportunity to promote the Choosing Wisely 5 questions. And from a campaign perspective, it gave us a broader community message that could resonate beyond the confines of dermatology or even telehealth. We engaged with a number of stakeholders from the outset, with college's Community Engagement Advisory Committee on the early draft of the guide and our overall approach, with NPS Medicine Wise and Choosing Wisely to incorporate the 5 questions to ask, with Consumers Health Forum and their safety and quality and rural and remote special interest groups to provide feedback on the draft guide, and with fellows, trainees, practice managers, our social media community and patient support groups to help connect us with patients, their stories, and promote the campaign. All of this culminated in our final resource. Here you can see how the 5 Choosing Wisely questions were used. The theme of asking questions ran throughout the guide, with the specific mention of choosing wisely in the Getting Ready for Your Appointment section. It was very important that the guide provided a positive message and a supportive environment for people to ask questions, and our consultation with consumers and with Choosing Wisely was instrumental in shaping the messaging. The guide aimed to model the principles of best practice for clinicians as much as providing a valuable tool for consumers. The final page of the guide was an interactive notes page where people could write down or type the questions they wanted to ask beforehand, and then during the consultation, jot down important information and next steps. And here you can see how where the Choosing Wisely questions appeared. Our outreach to fellows, patient support groups, and the community directly led us to receiving a number of patient stories, quotes from which were published on our Worldskin Health Day webpage, and these case studies were also used for our media outreach. Again, the concept of it being okay to ask questions and that asking questions will help you get the best possible care was a central message of the campaign. We engaged a PR company to develop the media release and undertake media outreach. The okay to ask message featured prominently. We also developed a campaign toolkit in the form of a social media guide with visuals and example messages and tweets. A pre-launch letter and the campaign toolkit were sent to those stakeholders who'd been involved in the campaign development, as well as to Federal Minister for Health, Greg Hunt. And on the 14th of October 2020, an EDM was sent to just under 2,000 stakeholders. Social media activity for the campaign saw a marked and positive increase of up to 60% across our social media platforms. And this included Minister Hunt posting on his own Facebook page promoting the resource and the concept of asking questions. Between the 23rd of September and the 20th of October, we saw well over 250 external visitors to the Worldskin Health Day webpage, with 100 views and downloads of the telehealth guide. Our media outreach, made possible by the many patients and fellows who shared their stories with us, resulted in a number of radio, TV, and print interviews. These helped in our efforts to raise awareness of skin conditions and their impacts, the role of dermatologists, of telehealth, and provided additional opportunities to promote the resource and our campaign messages. A big thanks to the Choosing Wisely and NPS Medicine Wise team for their great work in promoting the resource. They've continued to do so over the past year, and we've appreciated the opportunity to appear as a feature article in their report. We have also continued to promote the resource to our own fellows and have featured the campaign, the telehealth resource, and Choosing Wisely in our member magazine and regular communications. All of this helps to keep the Choosing Wisely principles and the concept of creating an environment for people to feel comfortable asking questions front of mind. So 12 months on, and we're about to launch our Worldskin Health Day 2021 campaign. So chronic skin, hair and nail conditions are more than skin deep. They really do change the way people live their lives. And people with chronic skin, hair and nail conditions such as eczema, psoriasis, alopecia, acne and vitiligo often experience significant emotional and psychosocial distress. This can include pain, itch, increased levels of depression, anxiety about their physical appearance, fear of stigma and social isolation, impacting almost all aspects of daily life and their personal relationships. Finding the best possible treatment and support can make a huge difference. This year, we are encouraging Australians to talk about the reality of living with these conditions and highlighting the importance of seeking help. We're again celebrating Worldskin Health Day on the 14th of October with the launch of a new social media campaign, videos, and a resource hub, Help Helps. The Help Helps resource hub will include information on how to access specialist care, patient support groups, information on skin conditions and mental health. It also has a section on talking to your doctor, and this provides the opportunity to showcase Choosing Wisely's information and resources on communication with your healthcare provider and the 5 questions, as well as last year's telehealth resource. We're very excited about our Help Helps videos, which feature Australians talking about their journey of living with chronic skin, hair and nail conditions. They share how they've adapted and the difference seeking help from a dermatologist has made. We're really pleased with how strongly the message about the importance of good communication between people and their healthcare providers has come through. We hope these, together with the campaign messages, not only encourage Australians to seek help, but will alert clinicians and the community alike to the challenges of living with these conditions and model for our fellows and other health professionals the importance of creating a supportive environment for good communication. We'd love your support in helping to spread the word about the campaign. Our Help Helps resource hub will go live on Worldskin Health Day on the 14th of October, so please do check it out. To find out more about the campaign and get involved, you can use this Help Helps URL and follow the link to our Worldskin Health Day campaign webpage. We do have a social media toolkit available, or you can post your own Help Helps message on the day. We'd love to see some messages reiterating the Choosing Wisely message of it's okay to ask and encouraging good conversations. We'll be launching the Help Helps videos on the Resource Hub on the 14th of October. But in wrapping up, I do want to give you a quick sneak peek of one of the video cut downs. And thank you all for your time today.
My name is Bridget and I'm from Brisbane, Queensland. My skin condition is alopecia. I originally was diagnosed when I was around 16 to 17, and unfortunately for me it did develop into alopecia universalis, which is I have absolutely no hair, eyebrows, eyelashes or any arm or leg hair either. To me it's vital to develop an honest and open relationship with your dermatologist. The more that we know each other, the more she understands where I'm coming from if I don't want to try a particular treatment regime. Similarly, the more she knows me, she knows things that I may consider. Around my wedding, I wanted my hair and eyebrows regardless of the side effects. That's what I wanted. Whatever choice I made, she was my champion along the way to help me. You don't need to do this alone. Getting professional help helps.
Thanks so much, Caroline, and thanks for sharing the exemplary work from ACD in the consumer space as well. It's great to see what the colleges are doing. So I might just open the floor to questions. If you have a question, please feel free to put it in the Q&A or chat section, and Caroline can answer them for you. Looks like Scott has a question.
Thanks, Caroline, for that presentation. It's great to see the work that the college is doing. I'm just wondering if you have any, well, first of all, if you've seen a shift in, particularly in your fellows, in kind of how they embrace and talk about having conversations with their patients and, you know, the movement of choosing wisely. And, you know, has that made a culture shift among the fellows?
Yeah, I think that's something that we'd really like to look more closely at. I mean, certainly we've just been looking at our curriculum and how we can build in, well, it's got much more of an emphasis on those communication skills. But yes, I mean, certainly when we've been talking about this year's campaign, you know, we didn't have to prep our dermatologists in any way, shape or form. And many of them are featured in the full feature video that will be available on the Resource Hub. So, you know, absolutely we see people embracing those messages. But, you know, like any behaviour change, it's gradual and you need to keep reiterating those messages and just really as much as possible try to model those behaviours or show how people can live and breathe those behaviours in their everyday practice. So with the videos, we're, you know, kind of looking at how we can use those as part of our fellow and trainee educational offerings as well. So, but it would be great to be able to do a more sort of formal evaluation, I guess, of that as well in the future.
And do you have any advice for particularly the other colleges, you know, if they're looking to do work in this space, like, you know, how to start and what are the kind of key learnings?
Oh, for us, I mean, I've been at the college for a couple of years, and it's only really been in the last 4 or 5 years that we've been doing a lot more work in this space. So the first step was to engage with the patient support groups who are active in terms of skin conditions, skin, hair and nail conditions. But when it came to the telehealth guide, you know, reaching out to CHF and their special interest groups and talking to our own community engagement advisory committee and getting their advice was really critical in terms of the framing of that messaging. And we've also got one of the members of our community engagement advisory committee who works very closely with ethnic community councils, and her advice on language, you know, what language to use was incredibly valuable. But our key message from the 2020 campaign came from one of the patients, and I think the same's true with the messages that have come through in the video. They're what have then formed our key messages for this campaign. So yeah, get out there and speak to the community.
Caroline, there's a question in the chat. Carolyn Stapleton has said excellent work. So Chris has asked how you have engaged the politicians. Any tips and tricks that you can share?
It does depend how topical the issues are that you're covering at the time. I think so. You know, with the telehealth guide, we were already that was already an area of advocacy for us. So. And our guess, it was a positive message which aligned well with the messages the government were putting out at the time in terms of, making sure people could access care during the pandemic in difficult circumstances. So I don't have any magic tips, but it is about finding areas of common interest, but also reaching out and giving them a heads up that you're doing some work in a particular area and seeing if they would like to be involved.
Thank you. You must have pitched it really well as well. Any other questions from anybody? So have you had any feedback, I guess like personal stories from consumers about how the 5 questions have perhaps improved, the conversations with the health professionals?
Yeah, I mean, we haven't around the 5 questions specifically, but we did have some very positive feedback on the guide and the value of having questions that could be asked. So I think that those tips and tricks on how to prepare and then integrating those questions in there is really useful. And I think, in the future it depends on the message as well, how much we emphasize the 5 questions versus asking questions more broadly as well. But certainly, there's questions around, what are the risks? What are my options? I think they're all really valuable. And we've also, in the last year outside of the campaign, but we've also made a number of enhancements, I guess, to our own web pages where we've had information on preparing for your appointment and asking about, benefits, risks, costs, all the rest of it. So I think they're useful.
Right, that's great to hear. Okay, I don't think there are any other questions. Scott, did you have any questions left?
No, I don't have any other questions. But thanks, Caroline. I think it's so great to see you promoting the Choosing Wisely 5 questions, but also, I have had a sneak peek at some of those other resources that you'll be launching next week, and I think it really does capture both from the patients and the health professionals' perspective, the importance of conversations.
Yeah, we're really excited about them. So yes, like and share, I think, is the my closing remarks. So, but thank you to everyone for
so everyone get behind World Skin Day, and thank you so much for sharing what the colleges are doing as well, Caroline. Have a great day, everyone.
Thank you.
Thank you.